This is a 80-year-old male with closed head injury with loss of consciousness earlier in 2017. The CT was done and showed hemorrhage within the sylvian fissure and within the prepontine region, dense on the sylvian fissure region, and relatively faint blood as compared to the other one in the prepontine region. What I'm trying to show here is the original report was called for subarachnoid hemorrhage and increased density in the region of the basilar artery tip. So aneurysm or focal hemorrhage are possible. So MRI was ordered, and I'm reading the MRI. First of all, point number one is it's difficult for T2 to detect a small amount of blood in the prepontine region. Flair see it better because of water suppression. You can see it. The sylvian fissure hemorrhage is, I guess, is better seen on CT than MR, which is obtained pretty close together within a few hours. As T2, you just don't see that blood product well. On gradient echo images, you can see the hemosiderin in the sylvian fissure, the hyperdense region, the more clotted portion, have the hemosiderin, and the prepontine cistern, you just don't see that blood product well. So you just cannot say that without seeing the hemosiderin, there's no blood. So sometimes the CT, and many times the CT, is more sensitive. But there's also a finding that was not called in this picture. On the CT, in this area, there's a small amount of subarachnoid hemorrhage. I'm sorry, small amount of retinal hemorrhage, not subarachnoid hemorrhage, retinal hemorrhage. So I measured here, and then there's a small amount of blood here. Coronal picture, you can see there's a little bit of lesion in the superlateral aspect of the right eye globe. Similarly on CT, it's hard to see. It's just incidental findings, so always look at the eye globe to find out any subtle lesions. This was the impression, original report impression, and then we should learn that the teaching point is not all blood are seen on GRE sequence. T2 is not good for blood product versus Flair signal, and there's some difficult to diagnose retinal hemorrhage on CT.